This week, we're going over basic spinal anatomy. The cervical spine has 7 vertebrae and spans from C1 through C7. Our thoracic spine has 12 vertebrae and spans from T1 through T12. And our lumbar spine contains 5 vertebrae spanning from L1 to L5 for a total of 24 total vertebrae from cervical all the way down to lumbar spine, not counting our sacral region. Let's take a look at our first vertebrae, C1, also known as the Atlas, named after the Greek titan of endurance and strength who was forced to hold up the heavens for eternity on his shoulders, aka this guy. C1 connects with C2, also known as the axis, to form a pivot joint. You'll notice in this animation there is no spinal disc in between C1 and C2, as this is where most of the motion in your neck is going to occur. We learned from the previous animation that the C-spine consists of 7 vertebrae. The primary function of the 12 vertebrae in your thoracic spine is to support the rib cage, which protects your vital organs such as your heart and lungs. Because of this role, very little motion occurs in the T-spine. The 5 thickest vertebrae create the lumbar spine. Its role is to support the weight of our body, which makes it no surprise that it is the most common site for injury and surgical procedures. Between L4 and L5 is where most of the motion in our lower back occurs, allowing for twisting, bending, and moving in multiple directions. Lastly, we'll go over spinal discs, which allow for mobility throughout the entire spine. These are mainly made of fibrous material and water. In an upcoming video, we'll go more in depth about the central nervous system and common back injuries.